Assalamualaikum and good evening. I bid to all judges, doctors, lecturers and to all my fellow friends. My name is Hidayah Binti Othman and along with me Izzah Syuhadah Binti Khirunnizam, we are going to present the sufficiency of clinical session in relation to the molar endodontic requirement in University Technology Maram. Root canal treatment is the most technically demanding procedure and requiring a high level of technical skill. That's why clinical competency assessment are important for dental curricula to ensure graduates are fully prepared for the independent clinical practice. Based on the assessment that was endorsed by Malaysia Dental Council or MDC, students need to complete one multi-rooted tooth endodontic upon their graduation. However, there is a study done by Muhammad in 2018 found that Keen South University students hesitate to do molar endodontic due to multi-root and complication during root canal treatment. They also listed maxillary and mandibular first and second molar as the most difficult teeth to treat. Thus, Jonker and Monset 2016 suggests to give a proper clinical time for a student to complete the treatment without any mistake due to rush efforts. Hence, General Dental Council in United Kingdom also mentioned about the responsibility of dental school to devise curricula, and unfortunately, to date not many studies have been conducted to assess the sufficiency of clinical session for molar endodontic treatment. Our study aims to investigate the sufficiency of clinical session provided to the students to complete a molar endodontic requirement, and number 2, to determine the stage that require the most session in the treatment. Our study is a retrospective study that was carried out with a total 90 final year dental students from 2018 to 2020. Firstly, we got the ethical approval from research ethics committees with the approval code as shown in the slide. And then for data retrieval, we got the approval to assess students' clinical logbook, patient's progress note, and also the permission to use Umbrella Clinic for the purpose of data collection. And with registration number of patients, we can assess the number of clinical sessions for each stage that was done by the student. And then data collection. After we get all the information from items or information dental management system, we put into a table and summarize in Microsoft Excel program. In the case where multiple stages were performed on the same date, the session was noted under the lettermost stage only. Table 1 shows the example of dental record. For example, for student Z, he did the END or examination and diagnosis on the same day with the assessed cavity. So we noted under assessed cavity as one session. And then for next visit, he did working line determination and shaping and cleaning for next visit, one session. But for trial GP, he did on the same day with the obturation. So we noted under the lettermost date, which is obturation, one session. So the total number of sessions that students are required to complete a molar endodontic requirement is 4 sessions. Next, we summarize into a table 2. Table 2 is the tabulation of summarization for dental records. Lastly, data analysis. We analyze all the data by using SPSS. Mean and median for total number of sessions among 3 batches were calculated using descriptive analysis.
Assalamualaikum and good afternoon. My name is Izzah. So now I'll proceed with the result. The outcome revealed that the average clinical session needed by the student is 5.14 sessions. It is considered a great result as the number of clinical sessions that the student use are within the student learning time that is given by the faculty, which is 5 clinical sessions. A few students managed to complete a 1 molar endodontic treatment with only 3 sessions. However, the maximum clinical sessions needed by the other student was 9 sessions. The data was then classified according to their batch labeled batch 8, batch 9, and also batch 10. The minimum clinical sessions that each batch needed in order to complete a 1 molar endodontic treatment was only 3 sessions. For students in batch 8, the average session they required was 4.85 sessions with a maximum of 7 sessions. While in batch 9, the average session to complete the treatment was 5.26 sessions and the maximum clinical session was 9. And last but not least, the average clinical session required by batch 10 was 5.36 sessions with 8 sessions as maximum. This bar chart shows the highest number of clinical sessions that the student needed to complete each endodontic stages, and it has been classified according to the batches. Most of the stages have the average of 1 to 2 clinical sessions for them to complete the stage. However, we can see clearly that during the stage of shaping and cleaning, the students require more sessions, especially in batch 10, where they require 4 sessions in order to finish it. The students are allowed to perform molar endodontic requirements starting from year 4, provided they have enough skills and experience during single canal endodontics on patients. The pie chart exhibited the percentage of students who managed to start a molar endodontic requirement in year 4 and year 5. A total of 37.8% students managed to start treating molar endodontic cases as early as in Year 4 and continue to accomplish it in Year 5, where 15.6% from Batch 8 and 13.3% from Batch 10 managed to do it. However, only 8.9% of students from Batch 9 managed to start in Year 4. There is a huge difference between the highest and the lowest number of clinical sessions needed by the student. Why there is a big gap? So now, I'll be discussing about the reason behind it. So the first factor is due to the failure of the students to locate the canals. Upon observation, there was a student that requires 7 sessions to complete a 1 molar endodontic treatment. This is because he could not figure out the second mesiobuccal canal, which is also known as MB2 canal. After referring to a specialist, the MB2 canal is found, but it was calcified. According to Tabassum et al. In 2016, they discussed that during the endodontic treatment, missed canal is not an uncommon practice, especially with inadequate access opening. So the second reason that leads to the delaying of treatment is due to fractured instrument. Our data shows that 5.7% of the students consumed 4 clinical sessions due to the same problem. The mishap was commonly spotted during working length determination and also shaping and cleaning of the canal. It was believed that the file was broken due to fatigue after multiple usage. According to Padir et al. In 2016, they reported that during endodontic treatment, 57.6% of the dentists and 7.6% of dental students has broke their files. Thus, this is not an uncommon endodontic complication. So the third sources of the delaying is due to formation of latch. There was a student that could not figure out the length of the mesiobuccal canal. So he referred the case to a specialist and a latch was detected on the first mesiobuccal canal. The latch was then bypassed and its patency was achieved by the specialist. This has been proven with the research by Al-Rahabi on 2017, where he identified the latch's formation was the common error during root canal shaping and cleaning. Next, patient factor could also contribute to this situation. There was a student that requires 9 of her clinical sessions. On closer look, she spent at least 2 sessions to complete each stages. On pre-endodontic stage, there was bleeding at the patient's gingival margin that could not be stopped, so the tooth had to be restored temporarily and the treatment was continued on the next visit. During shaping and cleaning stage, the patient could not tolerate the pain even after adding 1.5 cartridges of local anesthesia. Thus, once again the treatment had to be postponed. The situation that the patient was having is what we call as flare-up. It is an acute inflammatory response that will be triggered if the periradicular tissues are damaged during the manipulation of the root canal. So according to Syuhadah et al. In 2004, even though the inflammatory response provides protection against infection, it also can result in unpleasant outcomes such as pain. Moreover, patients who are unable to come on time is one of the causes resulting in the delay of the treatment. Punctuality of the patient is supported by other factors such as traffic jams and sometimes due to the distance between their house and the clinic. And last but not least, the COVID-19 pandemic. The students had to postpone all of their clinical activities. This is because all clinics were forced to shut down as per government order. The situation had a great effect to the patient and also to the student, as it has caused a lot of delay and unfinished treatment. Throughout our research, there were several limitations that we have to face. The retrieval of data records was very challenging as most of the data has been deleted from items. Plus, with the graduated students who cannot recall the correct patient's name or their registration number make it even harder to trace the data. This is because once the students have discharged their patient from their names in items, there were no more records of patients treated by them. We are suggesting for the faculty to come out with a section whereby dental records should be made available for research purposes or curriculum improvement in the future. Additionally, the COVID-19 pandemic was another important factor in which many students cannot provide treatment to their endodontic molar patients. Thus, the number of samples is affected. So, in a nutshell, the result of this study indicates that the clinical sessions provided by the Faculty of Dentistry University Technology Mara are sufficient to complete 1 molar endodontic treatment, which is 5 sessions. Certain stages require more sessions due to some complications such as broken instrument inside the canal, latches formation, and also missing canal. Other than that, patient factors such as difficulties or failure to attend dental clinics and unsuitable case selection could also be one of the reasons some students require more sessions than the given hours. The shaping and cleaning stage accounts for most clinical sessions to be completed in molar endodontic treatment. Moreover, no studies have been conducted in Malaysia. Hence, this study could also be used as a reference to improve endodontic modules.
Kindly scan this QR code to see our reference.
With that, we thank you.